Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back to Open Your Eyes on this lovely Wednesday morning. We are now moving into our first segment. Of course, it is a COVID-19 update, our courtesy Fulltech Systems. We'll be taking a look now at mental health and COVID-19. Now, we know the situation, what the situation is across our country, and we've got Iveth Quintanilla, who works at the mental health unit of the Ministry of Health, in with us. Iveth, good morning.
Hi, good morning, John.
And how are you?
I'm good, thank you.
All right. So, Iveth, you know, this is definitely close to home, within everybody's homes, in terms of how we feel. Every day there is a rise in cases throughout the country, and the numbers continue to skyrocket. Everybody for this particular time feel that they know somebody who is suffering from COVID-19, and it doesn't sit well within our minds or for our mental health. Can you tell us what the situation is right now, and what are people asking at this particular point?
Well, we have a lot of people who have been getting in touch with our psychiatric nurses, and the main symptom that is being displayed at this time is anxiety. People, you know, they're worrying about the increasing number of cases, and they're also afraid that, you know, they might contract this virus. Along with this is coupled the financial situation, because many people have lost their jobs. So this creates more hardship for families, and it increases the anxiety that people are suffering at this point.
Yeah, I'd say that's already two big things that people are going through. Let's try to break it down to talk about what the general population feels when we face this unknown situation. The pandemic has been going for a couple months now, and since we've had a recent spike just in the past few weeks, I think everybody is kind of like collectively on the edge of their seats, worried about every symptom they feel. Yeah. What happens to us psychologically when we have this level of stress about the situation?
Well, whenever we face stress, you know, our body tends to react in different ways. Yeah. However, the focus should be not on the symptoms that we are experiencing, but on identifying ways that we can cope. That is the main point in dealing with this pandemic and the anxiety and the stress that people are suffering. We all know that the stress is being manifested in different ways. You might have physical symptoms like stomach upsets. People might respond through anger, frustration, irritability. There are different ways that people are reacting as we face this pandemic. But like I said, the focus should be on identifying ways that we can cope.
Yeah. So you mean that you may see loved ones exhibiting a change in their behavior just as a result of the compounded stress of what's happening right now?
Yes.
Now,
yes.
If that's, and sometimes it's us, sometimes we get maybe a buildup of anxiety or start to feel overwhelmed with the situation. What are some of the coping mechanisms recommended to be able to cope better through this time?
Okay, we need to focus on the things that we can control. One of those things that we have been sharing with the public, you know, since this pandemic started, is the hand washing for the 20 seconds. You know, practicing the cough etiquette, maintaining the physical distance, the 6 feet apart, you know, avoiding gatherings where there are a lot of people. We need to avoid that. Avoid touching our face, our eyes, our nose, our mouth. And then also, if we are having any symptoms, then we need to seek medical attention. For example, if we present with fever, cough, difficulty breathing, we need to seek medical attention. Also, as well, Some of the things that we encourage is to maintain contact with the family members. We know that we cannot be together at this time, but that the physical distancing does not mean that social distancing. We can still maintain contact with the family members, with friends. You know, you can text, you can email, you can video chats, you can do different activities together still yet, even though we might not be physically together. Yeah.
But
so
I'd like for us though, because it is very important. A lot of people would actually tell you, you know what, I'm not stressing, it's just a Passover, it will eventually come to an end, when in reality they are, or probably they are not able to identify what the stress is. And I'd like for us to take our times when we go through this and go over it again. Reason being is because we want for folks to understand why or what exactly these signs are that they are stressing or they are having, suffering with anxiety. Well, let's get back there, Iveth, please. So the way they take care of themselves and whatnot. Let's go there.
Yes. Well, just to elaborate more on, the symptoms of people feeling stressed, and it had been mentioned before, people feel overwhelmed. And this may be due, to the constant media coverage of the pandemic, the fact that people are using masks, things that, it's something new. We have never done this before. Or because people have been isolated or quarantined. There is anxiety, there is worry, there is fear. People might feel sad, tearful. They may lose interest in activities that they used to do before. So all of these things are some symptoms that people might be experiencing. Like I had mentioned before as well, the physical symptoms, the stomach upset, the fatigue, frustration, irritability, anger, restlessness, agitation. These are all symptoms that people might be experiencing. Some may feel helpless. Some may have difficulty concentrating or sleeping, or they might feel disconnected from others. And still yet, there are others that might be experiencing at this point panic attacks. Okay, they might feel that they cannot breathe. And this is compounded by the use of face masks. Some people might, whenever they have this panic or anxiety attacks, they feel that they might be going crazy, like they want to run, they want to shout or scream. But this is part of the anxiety. And when these people are experiencing these symptoms, we want to encourage them to seek help. We are there, the professionals are there, and we are ready to provide that assistance to the public.
Yeah. You read out that list of symptoms, and I think that, I'm sure people all over this country who are watching can identify with one or several of them. And it seems that it's a collective experience we're all having at the same time. But there's a difference between some people who are able to overcome, whether it's the irritability, the fatigue, the feelings of overwhelm, and some where it becomes a critical situation where they're not functioning as well as they should. What is the defining factor? What makes, is there a reason why some people are still able to continue to function versus some who start to lose that ability?
Yes, of course. This is not the first time that people are facing stress or difficulties. So oftentimes people tend to build an inner response in terms of dealing with stress, with anxiety. And most people are able to use these same skills that they have mastered over the years. And they are able to cope with this situation. However, the people who have not built up this resilience might be the ones who are not coping well, or it might be that, you know, coupled along with that, there are other factors. For example, you know, since the children are home, or the spouse or is home, you have relational problems, or different other factors that might be impacting, so that the person might, you know, the response might not be there, and then they are unable to cope.
Absolutely. And also a bit of adaptability too. This is one of the times where if you're flexible, you're probably coping a bit better too, right?
Yeah. Definitely.
Now, when you talk about, and this has been, I think, you know, one of the recurring advice that we've been hearing during this time about taking time to focus on what you can control. Like, you can control how much you're gonna search and read articles about COVID, watch COVID coverage on the television, how much you're gonna be consumed by it, controlling your own personal behavior. Now, it's difficult. I've noticed that for some people, it's very difficult to separate what everybody else is doing, because by nature of how the pandemic worked, we need everyone on board. So you have some people who simply are consumed by what everybody else is not doing. What's your advice to them? Because they get really worked up. I get it, you know, you see people not wearing a mask or not wearing it properly. You know, you want to tell them something, it makes you upset, it gets you angry, it gives you more negative feelings to add on to what you're already experiencing. What's your best advice to people like that?
Well, the advice that I would give them is, you know, that like I said, we cannot control the behavior, the action of other people. And in order for us to ensure our safety and the safety of our family, then we should enforce or practice the things that we know that will help to keep us safe. So instead of, you know, focusing on all the negative comments or negative behavior from other people outside, we do not take it onto us, but we work on ourselves so that, you know, we do the right thing and we practice the things that will help us to better cope.
You know, Iveth, this pandemic has definitely caused in the household loss of jobs, loss of lives, a heavy consumption of alcohol, and I think those who are actually feeling the brunt of this are the children in the household. They see what's going on, they're hearing what's going on, might not understand, but they see the difference in movements when it comes to mother and father. How do we address this situation in dealing with the children so everybody could be steady within the household?
Yeah, when it comes to children, you know, they are one of our vulnerable population.
Yes.
With children now, we need to limit the exposure to the media. At the same time, this does not mean that we will hide anything from them, but we need to explain to them in terms or in words that they will be able to understand. We use simple words so that they can understand. Many times when they see or hear things through the media or through friends or through other people, they might misinterpret the information. So it is always important to check in with them and see what they understand. And, you know, we as parents should clarify to them and explain to them what is the situation. And when it comes to, you know, like having a family that has to be quarantined, or even having a family member who has passed, with the younger children, the toddlers, they might not be able to understand the concept of death. As they might feel, you know, that the family member will return at some point. However, the older children from 5 years and up, they are more able to understand. And as painful as it is, you know, we need to take the time to sit with them and explain what is happening. Like I said, in words that they may be able to understand. And as parents, yes, we need to model the behavior, because children pick up the cues from parents.
Now, what's different about today's conversation is that we have over 600 people in this country who are positive with COVID-19. We've also seen a number of deaths over the past few days. And it's a very difficult situation for many reasons. One, you know the potential fatality of the disease, but it's also compounded by the fact that you are supposed to be in complete isolation. Now, let's take a moment to talk to these persons, Iveth, and what they can do to be able to calm their own nerves about potentially developing severe symptoms and spending all that time alone as well.
Yeah, it is a very difficult situation for those people who are in, self-isolation or quarantine, because of the vast amount of time that they have on their hands and really not being able to do much. However, one of the things that we encourage is for them to have a routine. Yeah. By having a routine, you have something established and something that you can look forward to doing. And being in self-isolation or quarantine does not mean that, you will just be there not doing anything, but there is so many different things that you can do when you have this time on your hands. We encourage the reading of books. You can listen to music, you can sing. Actually singing, it releases endorphins, which, it makes us feel good. Yeah. You can also exercise. You can take the time to exercise, as this is very helpful for people. And also, even though people are in these situations, like I had mentioned before, it does not mean that people are alone. We have the internet, and we can maintain that communication with loved ones, with friends, and you can do things together. You can exercise, you can do so many different things online together. You can cook together. And these are just some examples of what people can be doing at this time.
Definitely. And the added layer of stress here is talking about the level of stigma and discrimination that's taking place. So we've all seen it. There's a case confirmed maybe in your village, and everyone becomes an investigator or a detective and starts, trying to figure out who it is, which family, criticizing or critiquing where you've been, what you've done. And to be honest, many of these people may not have known they've come in contact with a positive person, but nonetheless, their families are, basically the talk of the town, and it's a very challenging situation to cope with. Talk about what that adds to the level of stress that the positive patient as well as their family may be going through, so that all of us can understand why we need to challenge ourselves to not feed into that energy.
Yeah, of course. The stigma and discrimination does affect the people who have tested positive, as it adds added stress to them. And that is not what we want for them, but we at this point is the time when they need more support and care, and that is what, as a population, we need to be providing to these people, rather than, being sources or contributing to added stress to the people. We need to be supportive. I mean, it can happen to any of us. We still have people that need to come out to work, and it can happen at any time. It can happen to any of us. So we need to be supportive of each other. We need to build each other, and that is the only way that our nation will be able to pull through out of this, stigma and discrimination that continues to happen.
Iveth, you're right. It can happen to anybody at any time. It can happen to any of us. And for that reason, we definitely would like to seek help. We'd want to get that help, so we could eventually get back to, a state of calm, a sense of calmness. But let's talk about myself approaching the Ministry of Health for that help. Can you walk us through that process of receiving that help from MOH?
Sure. Whenever anybody is displaying symptoms, we encourage that person to call the hotline, or we have as well, each district has their own numbers that can be accessed, but the hotline, as we all know, it is free.
Yes.
So we have been having the public calling into the hotline, and then from there, we advise them on what they should be doing, should they at any time present with any symptom, or should they be reporting that they have been in contact, with somebody that has tested positive.
Yeah.
So we guide them through that process in terms of what they need to do.
So let me go back to the question I had about positive patients, because the other scenario I wanted to discuss was addressing the issue of death. We know that people who are COVID positive can die as a result of this disease, and it's one of the predominant fears that we all have about getting it if we have it, and the greatest challenge is because of the contagion and the newness. When someone goes into the hospital, if they die, it may be the last time you see them. How do you confront something like this with your family if you are positive? What kind of conversations should you have?
Well, we encourage the public, to discuss this as a family, and it comes with getting prepared. We know the pandemic is here, and it is here to stay. We have to learn to live with it. However, as a family, we need to start putting steps in as to how we will be living with this. And one of the possibilities is death. So as a family, we encourage the family to sit together, to have a plan in terms of being prepared. That is the first step, in ensuring that you have available your hand soaps, your tissues, in practicing at home as well, your cough etiquette, your cleaning of surfaces. And if at any time anybody tests positive, then, implementing the measures so that other family members do not become infected. Yeah. And this is the advice, that the ministry keeps putting out there. There are steps that can be followed. But as well, when it comes to death now, it is a very sensitive topic. However, we need to discuss as a family that it is a possibility, and what are the things that we can do should this happen. Although it is a very difficult situation and it is something new, we need to find ways, identify ways how we will be able to cope with this. We know that when somebody dies, we cannot be with our loved ones during the last moments of their lives. As you know, this is something that as families we normally do. We are there with our loved ones until their last breath, but we cannot do this at this point. So we always say this: when the person is alive, we need to express our love for them. We need to be united as a family, as we can never know what will happen.
Yeah.
However, if it should happen, that somebody passes away, and the persons are having difficulty in coping, we encourage persons to seek help. The psychiatric clinics are available, where the psychiatric nurses can provide more in-depth support and service to these people. However, we do have some tips in terms of helping people to cope whenever they have lost loved ones. And we encourage the connecting with people. You ask your family members to check in with you, maintain your calls. Again, the internet is available, or through text messaging. You ask your family members to share stories. You can share pictures. You can even set up in your own household a special place where you can set up a picture of the family member who passed, of the loved one. You can light candles, and it will be a special place where, you know, you remember this person. And, you know, prayer. The Belizean people, we believe in God, and prayer, it helps. It helps. And also, we must not forget, you know, the self-care, the eating healthy food, the sleeping, getting enough sleep at night, because we have to take care of ourselves as well during these difficult times.
Yeah. And what about healthcare workers? So they're, you know, frontline people. They're those who are already prepared to deal with COVID-19 cases. But I'd imagine any nurse or doctor, any part of the country, are probably really concerned about their own safety, the safety of their patients, as at this point, we don't know every person who is COVID positive. So, and then they think of having to go home to their family and the interactions they'll have there. It's a lot to take on for an individual.
Yeah, with our frontline workers, since this pandemic started, we as the psychiatric nurse practitioners have been reaching out as well and providing support, teaching the staff the skills to better be able to cope with this pandemic. It is something new as well. It's something that we have never experienced. You know, there have been other very contagious diseases out there, but it has never really reached our country until at this time. And we have been implementing or teaching the skills to the frontline workers for them to be better able to cope. And we understand, you know, the fear associated with it as well in contracting the disease at work, taking it at home, and, you know, taking it to your family. And we understand this fear at this point. However, support groups have been created as well for the frontline workers so that they can better be able to cope.
Okay. And of course, you mentioned it earlier, and I want to make sure that we get a chance to talk about it. Those who are facing unemployment in the pandemic, we have heard some horrific stories of families who are really struggling to be able to just provide basic needs. Yeah. And it's been for a while, especially since the collapse of the tourism industry. You know, being able to meet your basic needs is one thing, but there's a grave impact that can have on your mental health. What type of support can people offer to them, and what would you say to them about being able to help to put themselves in a better place?
Yeah. These people who have become unemployed, it is an added stress or burden to them. Yeah. And many people are seeing it very, very hard at this time. However, like I said, the support is there. We have the nurses who are readily available to provide the support to these people, because we find that many people are not coping now with this added stress. However, it should also be part of our plan when it comes to readiness, because we do not know the future of our economy. Yeah. And there are possibilities that, you know, more people will lose jobs, or even we don't know what will happen. Yeah. However, we need to have our personal plan in terms of, you know, what we will do. As well, I know there are agencies that are providing assistance. So we have our social worker who is attached to the program, and through our social worker, we try to provide, you know, the assistance through that aspect. But when it comes to the mental health of the people that have become unemployed, and we have certain people that have been reaching out to us, you know, we have been providing that support to them. And for those that, you know, are suffering in silence, they don't need to do that, because we are there. The support is there. The mental health program is there, available, willing to provide that support to the population.
Definitely.
Yeah. All right. And, you know, I think that for me, the last question is, how do you encourage now? everyone I think is a level of a hypochondriac at this point. We feel something and we start thinking, oh my gosh, I have it. You know, these are some of the added stressors that we put on ourselves as well. But beyond that, there's also the recommendation about interacting with your family and not letting your guard down. This is a difficult adjustment for people because we always trust family, close friends, and even coworkers that we interact with every day. But in fact, we know that they are the most likely persons to infect us. How do you advise people, if you're to tell people about how to listen to the recommendations despite what feels good to them, to follow through?
Yeah, we cannot let down our guard. And as has been said, we have to treat everybody as if they are positive. So even when it comes to our family, within our household, we encourage the public to keep practicing the measures that the ministry has set out in place. At no point should we let down our guard, even when it comes at work. Oh, it's our colleague, and you know, we tend to interact a lot with our colleagues at work. However, we encourage the use of masks at work because we need to keep our level or being on alert at all times. Like I said, we have to treat everybody as if they are positive. So we still encourage the hand washing, the cough etiquette, the use of masks, the avoid touching of face, mouth, and nose, and all of the implementations that have been put in place.
All right. And once again, the Ministry of Health does offer mental health services. So the psychiatric nurses, they're all over the country, right?
Yes. Each district, we have our psychiatric nurses, and we have 3 psychiatrists. We have one in Corozal, we have one in Cayo, and then we have one in Belize City as well. We also have a counselor attached to our services in the Belize City. And like I had said, we also have a social worker with our program.
Okay. And once we contact the Ministry of Health or contact the clinic in our area, we can book an appointment with one of these psychiatric nurses.
Yes, definitely. We keep providing this service to the public. The clinics, they're all open. And if, you know, some people don't have the credit to call, we encourage the public to call the hotline, the 0800 MOH Care. And from there, we can liaise with the districts in order to provide appointments for these people.
All right. Any final advice to our viewers?
Sure. I would like to again repeat the guidelines that the Ministry of Health has been providing in terms of providing our own self-care, which is maintaining our physical distance, keeping our 6 feet apart, continuing with our hand hygiene, avoid touching our face, mouth, and nose, practicing our cough etiquette, seeking medical attention should we present with any symptoms, staying home if we are ill, and avoid gatherings, as well as taking care of our mental health. Remember, you do not need to suffer in silence. The services are available. The psychiatric nurses are there to provide this support to the public.
All right. So now we know. And of course, Iveth Quintanilla, we want to thank you so very much for your visit this morning and sharing with us exactly what we should and should not do, especially in these times. Thank you.
Thank you as well.
All right, so there we go. We're about to take that break, but when we come back, the hurricane season is here. Be prepared. We'll have a representative in from the Belize Red Cross Society to tell us how we can prepare. That's when we come back. Stay with us.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.